It's Patrick Hutzel from Intensive Care at Home, where we provide adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog I shared what do ventilated adults and children with tracheostomies need for in-home care. You can check out last week's blog by clicking on the link below this video. In this week's blog I want to discuss, is it ethical to leave long-term ventilated adults and children with tracheostomies in intensive care? Ethics and morals are important issues when it comes to healthcare. Ethics and morals are even more important in a highly emotionally charged and volatile environment like intensive care. And everybody who has worked in intensive care for a while, anybody who has been a patient in intensive care, or who ever had a loved one in intensive care, will understand that discussion around ethical and moral issues and dilemmas in intensive care is inevitable. Ethical and moral issues and dilemmas when it comes to long-term ventilated adults and children with tracheostomies in intensive care are often high on the agenda, and they can't be ignored, and neither should they. What do I mean by that? For example, if it takes almost 12 months for some long-term ventilated adults and children with tracheostomies in intensive care to leave such a depressing, sterile, inhibiting and limiting environment like intensive care, there is something seriously wrong in a first world country like Australia, but probably also in many other first world countries like the United States of America or Canada or the UK. After a while in intensive care, even ventilator dependent and tracheostomized adults and children are medically stable and off inotropes, so that they are in a position to continue their care and treatment at home with specialized and accredited services like our intensive care at home nursing service. It is neither ethical nor is it cost effective to look after long-term ventilated adults and children with tracheostomies in intensive care once they are medically stable, off inotropes, and the main reason for their stay in intensive care is their ventilator dependency with tracheostomy. Think about it. If a long-term ventilated adult or child with tracheostomy in intensive care and their family continue to stay in this limiting, inhibiting, sterile and depressing ICU environment, there's a high chance that their condition deteriorates due to the depression and the lack of quality of life in intensive care. But also there's a high risk for infection in intensive care that you simply don't have in a home care environment. Imagine continuing care and treatment at home instead. It'll massively improve the patients and their families' quality of life, and on top of that, it's a massive cost saver. One ICU bed costs $5,000 per bed day, and when those beds are occupied by long-term ventilated adults and children with tracheostomies, they also block a critical care bed that could be used for other, more acutely unwell patients in need of an intensive care bed. Furthermore, similar services to intensive care at home have already proven their success and their concepts in Europe, mainly in Germany, for 20 years now, and it's proven that intensive care at home for long-term ventilated adults and children with tracheostomies is a genuine alternative to a long-term stay in intensive care. And it's the same here in Australia. Every day we are proving that our holistic model of care is working, and every day we actively keep our clients at home whom otherwise would be in intensive care. It's a win-win situation. Everybody benefits. Our clients and their families can be at home instead of intensive care. We send highly skilled intensive care nursing staff. ICUs have an empty bed, and the cost is way below $5,000 per bed day. It's a win-win situation, and we do it day in and day out. What are your thoughts? Do you think that it's ethical to keep long-term ventilated adults and children with tracheostomies in intensive care? Leave your comments on the blog. For more information you can contact me on 041 094 2230 or email patrick@intensivecareathome.com.au. That's Patrick just with a K at the end. We are also currently hiring enthusiastic clients in Melbourne. We would also like to hear from you if you have a minimum of 2 years pediatric ICU experience, as we have opportunities there as well. For more information, check out our career section or contact me. You can also contact me if you want to know more about how we can help your intensive care unit or your patients and your families, or if you have a loved one in intensive care that's on a ventilator with a tracheostomy, you can contact us as well. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I see you again next week in another update.